Hello, everyone. I'd like to welcome all of you to this year's Go course. And I'd like to introduce you to a new concept we've started at Go, and it's actually a new lecture series. It's called the Trailblazers in Practice Management series. And we developed this lecture series for two reasons. One, to provide an in-depth session on important topics in practice management, which we've learned from the pandemic. These in-depth discussions on unique topics are important. And also to recognize creative and accomplished thought leaders in the field of practice management. And in that essence, with me today is Dr. James Frakes, and today's inaugural lecture is named in his honor. I just want to take a moment or two to introduce you to Jim, and then we'll jump into a few questions. Today's in-depth session will be on leadership, and Jim, by all measures, has been an outstanding leader in practice management, a creative thought leader, and has really helped change and really plot out the course from the early days of practice management in GI. He is the co-founder of Rockford Gastroenterology Associates in Rockville, Illinois, which within the last few years celebrated its 50th anniversary, which is a great testament to his vision. He also was one of the early thought leaders and early adopters in building single specialty AECs, with a special interest in efficiency in practice operations, writing some of the early articles that helped really blaze the path for future owners and leaders in practice management and AECs specifically. He has been on multiple ASG committees, led multiple ASG committees, and has authored and co-authored hundreds of articles in the field of practice management and other aspects of clinical GI. He then was named to the Board of Governors of ASGE, and the crowning achievement of his career was being named President of ASGE. So with that, I want to thank him for spending some time with us and welcome him aboard for what should be a fun discussion on some thoughts in leadership. So welcome, Jim, and thank you for all you've done for the world of practice management and your colleagues in practice management and GI.
Thanks, Joe. Thanks for having me.
You bet. So what I thought we'd do is start off to have you give us some thoughts, comments on some strategies or leadership concepts that you found effective during your leadership time within your practice as managing partner and at ASGE. And then as a follow-up, anything you applied to some challenges within the practice or ASGE or thoughts you may have on leadership.
Well, as I started thinking about this a little bit, it took me back to the early days. And there really weren't any guidelines for leadership in practice management back at that time. When I finished my residency training, endoscopy was actually fairly fledgling at that point. And GI was primarily a thinking specialty at that time. So endoscopy had broken on the scene. We just had Tagamet as our first treatment for ulcer disease. And so it was really a kind of a primitive setting. And there were no guidelines really for how to lead a group or how to develop anything. So some of it came from the leadership of the group came really from learning on the job. I guess if I had to describe my management style or my leadership style, it would be prepare and persuade. And the preparation in some ways was a little hard because there weren't any guidelines in place. Practice management was almost considered a dirty topic. People didn't want you to spend time on thinking about making money, running a practice efficiently. They wanted to really concentrate strictly on the intellectual side of things. So as far as preparation, a lot of that came from study and a lot from experience. And the experience came from actually digging into problems and also from my time with the ASGE. I mean, I was on the practice management committee when it was just a brand new committee. I was on the healthcare policy committee when issues of reimbursement were first coming to the fore. And it was through those kinds of activities that I gained some experience. And then later, my co-trailblazer in all of this area, Gene Overholt, he and I put on, who was also a president of the ASGE before my time, we were very interested in bringing endoscopy out of the hospital and into the real world. And he and I had a lot of discussions, and we worked hard on trying to bring endoscopy to the outpatient setting. People forget that back in those days, 1980, when I came out of training, almost all endoscopy was done in the hospital setting. But it was clear to Gene and I that endoscopy could be safely conducted in the outpatient setting. And we set about to change the paradigm, which sounds much easier than it was. We had to learn about state regulations, federal regulations, reimbursement regulations. We had to somewhat contend with the hospital lobby, which really wanted to keep endoscopy initially in the hospital. So I had to learn about this on the fly, and it was quite an experience going to Springfield, Illinois, and talking to the regulatory people and dealing with them not really understanding what it was that we did. But after doing that, eventually, Gene and I had the first 2 single specialty ambulatory endoscopy centers in the country, which were state licensed, Medicare certified, and eventually accredited. And it was quite the journey. But as far as leadership goes, you have to prepare, you have to learn, and then you have to persuade people. And it wasn't necessarily easy to prepare our group for those series of events that led to us having that one of the very, very first ambulatory endoscopy centers and practices that were built around that concept. Within the group, there was a lot of trepidation. There was a lot of fear of failure and fear of investing in the practice and in the ambulatory surgery center. But eventually, we got over that. Now, so the preparation was learning about all of this, and the persuasion came through addressing individual concerns, and you have to be straightforward and honest and accepting of questions and try to answer and quell those anxieties that come up in a group, no matter what the question might be. You have to utilize individual strengths within the group because there were people in our group that had strengths unique from mine, and having somebody interested in the finances or interested in directly in the patient care aspects in the organization, you could call on other people within the group and and generate some buy-in to the concept, and then support each other in the group. Uh, Again, to quell those fears and try to kind of guide them through the process that of necessity I had to know more about because I had to learn about it. But then that knowledge had to be transferred to the other members of the group. And then you got to do the work. The building a structure which met all of the qualifications and satisfied all of the patient needs took a lot of time and a lot of work. And there were challenges along the way, and you had to deal with each one of those as they came along. I don't know if that gives you what you're looking for, but it kind of gives you a feel, at least, for the early days and how I tried to deal with those and tried to lead this new group, a small subspecialty group, and to see it succeed and grow.
I actually think that's perfect. We could have people stand up and lecture on, I have this type of lecture leadership style or type B leadership style, but this is real world experience, and I really like that prepare and persuade. I think that's really a phrase that can actually stand the test of time, and it got me thinking. Um, in addition to the prepare and persuade standing the test of time, we know practice management has changed greatly. The landscape of practice models has changed greatly. So, if you have any additional thoughts or advice beyond prepare and persuade that kind of stands the test of time despite differing practice models and differing practice times, we'd sure love to hear about it. So, I'll put you on the spot.
Well, in talking about persuading, you have to kind of remember that there are a lot of different people interested in different facets of that, and you have to persuade not only your group, but you have to persuade your patients. You have to be sure that you're guaranteeing that they're getting the very top-notch care they can receive. You got to convince the payers, because they have to feel that their payment scheme is going to be rewarded with high quality and lower cost. And you have to persuade sometimes your competitors, like the hospital, and you have to make them feel comfortable with you having your own operation. And you do that by forming good relationships with the hospital CEO, and supporting the hospital in the areas where you can, because it can be a win-win situation for both you and the hospital. They don't realize that right at first, but it takes building a relationship and quelling their fears, as well as those of your own group or those of patients.
Oh, thanks, Jim. This has been fantastic. Obviously I know you quite well, and I do think that this conversation really gives our colleagues in the audience a glimpse into your practice management mind, your creativity, and what has truly been an amazing career.
You have to realize that the landscape's always changing, and there were challenges during my practice time with payers. Managed care became a big concept, and it's only partially achieved its goals. But with the new paradigms, since I retired, I see more and more groups and individuals being interested in direct employment opportunities with hospitals or with large organizations. And I don't know how that's going to play out. I'm more used to the group practice model, single specialty group practice model, how that's going to work if you're owned rather than owning yourself. There's some challenges down the road, but I think that, again, preparing well and persuading well and having being honest and having good character will carry you through these challenges. I don't know which way the road will diverge from what I've known about, but I think you have to be optimistic and confident and prepare and persuade yourself and your partners.
All right. Well, thanks again, Jim. I think this was perfect for our audience. And again, thank you for all you've done for your colleagues and all you've done with for the ASGE. And having this lecture named in your honor was earned and deserved. So thank you. And thanks to all of you in the audience for attending Go course this year. And I hope you enjoy the course. Thanks again, Jim.
Thanks for the opportunity, Joe, and thanks for the honor of putting my name on the lecture.
Our pleasure. Enjoy, everyone.